Hi, my name is Mike Ingram. I'm a general dental practitioner from Peacock Dental Spa based in Loughborough, UK. And I just wanted a quick chat about free consultations. Most practices now offer free consultations particularly for treatments such as Invisalign or implants. However, for a patient who are looking around, it's a minefield because you don't really know what to expect. You're not familiar with the terminology. You don't really know what procedures are feasible or not, and most people don't even know the costs. So this is a bit of a guide for you just to help you through some of the pitfalls and potential pitfalls of free consultations. Certainly do this, shop around. You may need to travel some distance to find a practice you're happy with. Your dentist you may be very familiar with and you have a good relationship, but they may not be an expert in certain types of dental procedures, in which case they won't be offended at all, I'm sure, if you looked for other place, a bit more expertise. In fact, they may be quite happy to refer you on. You may not have a dentist at all, in which case you'd certainly need to shop around. I'd look for recommendations from friends as well and colleagues who've had similar treatment, because word of mouth still remains a very good recommendation. Obviously do Google searches and read not just the 5-star reviews but also the 1-star reviews of practices if you're not familiar with the practice at all. I would strongly recommend you visit the practice. We've all been on holiday and seen glamorous hotel rooms only to arrive at the actual hotel and see that it hasn't seen a lick of paint in 10 years. So visit the practice, get a feel for the practice. You need to be looking at, does the dentist invest in their practice? Do they really care for their patients? Are they trying to provide a good service, or is it just a money-making scheme? Is the dentist just allowing the practice, or the business owners allowing the practice to run down so they can maximize their profits? On that case, trust your instincts. You need to feel well cared for. You need to feel treated as an individual, not just another inquiry. Are the staff friendly? Are they taking enough of an interest in you? Are they trying to guide you down a certain path, or are they guiding you against something that may not be in your best interests? Don't be afraid to ask questions, particularly at first when you're starting out on your journey. You may not be familiar with all the terms, in which case don't be shy about asking questions. There's no such thing as a silly question. Things you will be very interested in are the immediate costs. Something that's often overlooked are the long-term costs. Some treatments, it's not, you don't get the treatment, walk away, and then never have anything done again. Just like a car, treatments need maintaining, particularly implants, and they need looking after for a long time. The life expectancy of treatments, how long will this last? We recommend most treatments a good life expectancy, which we count in decades. So if you're going to invest a lot of money in a treatment, you really want it lasting more than a couple of years. How long is your treatment going to last? Has the practice got any examples of work the dentist has done, so you get a good idea, a good feel, how experienced the dentists are, and what sort of guarantees do they offer? No treatment plan has a 100% success rate. No treatment plan has a 100% failure rate either. What sort of guarantees do the practice offer in the event of things not working out, and how will you be compensated or reimbursed or treated should that occur? And if you're not happy, walk away. There's a lot of competition for Invisalign and implants at the moment. Most practices are offering them. There's 30,000 dentists in the UK. Just go somewhere else if you're not happy. Because if you don't, and you don't trust your instincts, and you buy a treatment plan, you go on a course of treatment, you will be proven that your instincts were right in the long term. Don't do this. Buy on price. I would encourage anyone to shop around, but I would not recommend that you just go for the cheapest option. In no other industry I'm aware of is the adage, you get what you pay for, so true as it is in dentistry. So in that case, if it's beyond your budget, I would not have the treatment there and then. I would wait, I would save up, rather than either going for the cheapest option, which may leave you with irreversible harm to your teeth, or having an alternative treatment that you're not happy with. So if you're, say for example, you want Invisalign and it's over your budget, I would either get it on finance or wait until you can afford the treatment, rather than having something like composite bonding, which may, in your case, not be suitable and may give you a result that you're not happy with. Don't try too hard to compare like for like. It can be confusing with giving a price estimate for treatment, particularly with patients, and particularly with things, again, like Invisalign, where you get a starter pack and you get so many £1,000 off if you sign up now. And is the examination included in that? And are x-rays included in that? And are study models or the ClinCheck? And there's too much information. There's too many variables for you to really compare like for like effectively. So like I say, just go on instinct. Be aware that every dentist, every dental practice will have a spreadsheet where they put the costs in and they know how much they're going to get from each treatment. We're not stupid. We know the bottom line. So you will not get something for nothing. You will not get a steal. Dentists are far too wise and savvy for that. I'm not. I've got people to do it for me. But you won't get a bargain. Okay, we know our figures on this. So go back to your instincts. Do you like the dental practice or not? Don't expect a free consultation to be the same as examination. This is pretty much similar. We get a lot of patients expecting to walk away from their free consultation with a definitive treatment plan. We can't do that. We need to examine you. We need to know the health of your teeth, the health of your gums, in order to give an accurate estimate. A free consultation is a sales pitch. Let's be realistic about that. It's for you to find out whether you like the practice, whether you consider coming to us in particular as an option, and it's for us to show you how good we are. Okay, to give you a broad range of options for you to choose from. It's for us to get to know you. It's for you to get to know us, but it is not the same as an examination. You will not walk away with a definitive treatment plan from it. You may, at a later date, have a consultation, an examination, and find out that you're not suitable for it. Some practices do offer a free examination, but just remember, they're going to get that money back somehow. Don't agree to treatment without doing your research. Just don't go for the first one that you see. Have a think, make sure it's right for you. Quite often we get patients coming in asking for things such as veneers, and when they realize what's involved and the costs involved and the potential harm to their teeth, they realize it's not suitable for them. So do your research, allow the dental practice to give you information to educate you, to make sure that you are familiar with it, but don't go in blind. Do please remember that there's always someone that will do it cheaper. So we're based in Loughborough in UK. Our website, email and phone number are there. If you want any further information, give us a call. Thank you.